Often, patients who have fibromyalgia syndrome will have so-called trigger points. In the old days, we used to diagnose fibromyalgia by essentially pressing on a number of predetermined sites around the body, 18 different sites around the body, and if you scored more than 11, then you would get the diagnosis. Now, there are a lot of problems with that. For example, different pressures were applied, different clinicians examined different areas. There was a bit of hit and miss associated with that. We now use different criteria for the diagnosis of fibromyalgia syndrome, which is the ACR, or the American College of Rheumatology 2010 diagnostic criteria for the diagnosis of fibromyalgia syndrome. Now, once the diagnosis has been made, we will see patients and we will discuss the variety of treatment options to try and improve their fibromyalgia symptoms. The mainstay of treatment tends to be medication options along with physiotherapy-based rehabilitation and home exercise program. Now, from time to time, we do interventional treatments on patients with fibromyalgia. These tend to be things called trigger point injections. Trigger point injections are literally little injections into the painful muscle areas, and we have a variety. We can inject local anaesthetic on its own, we can inject local anaesthetic and steroid, or we can inject local anaesthetic and Botox, which we do quite often. The most important thing with fibromyalgia is that if you're considering interventional treatments, injection treatments, it's mandatory to get the pain under as much control as possible, particularly using medication, before even considering these types of intervention. Now, the reason for that is that the fibromyalgia is so widespread. If you start to inject patients, almost certainly they will have a flare-up in their pain and they will not thank you for doing that. However, if you're a little bit down the line, you've been treating a patient for fibromyalgia, you've managed to reduce their pain to a certain extent, but they still have discrete areas in their body where they still have pain, then trigger point injections can be extremely effective. As I mentioned, one of the ways is to inject long-acting local anaesthetic along with Botox. Where the Botox is injected, it has two major activities. The first one is that it will cause some local relaxation of the muscle, so it will provide muscle relaxation. And the second thing is that the Botox is incorporated into the local nerves, it's absorbed, it actually travels back to the spinal cord, and it has an inhibitory effect on pain as well. In terms of the risks and benefits, it is a very straightforward procedure. The benefits are pain relief, risks, failure, local bleeding, bruising, infection, discomfort, which are all minimal. Injection of Botox to trigger points is a very safe, very effective procedure, but as I would reiterate, it is vitally important that the majority of the pain is under better control before this treatment modality is considered.